Hello everyone, it's Dr. Sam. I'd like to welcome you to my EyeClarity podcast. This is a show that offers cutting-edge information on how to improve your vision and overall wellness through holistic methods. I so appreciate you spending part of your day with me. If you have questions, you can send them to hello@drsambyrne.com. Now, to the latest EyeClarity episode. Hey everybody, it's Dr. Sam, and I'd like to welcome you to another EyeClarity podcast. As part of our Summit series, I am conducting an interview today with a really special guest. She's also a featured speaker on the Summit, and those dates are January 14th, 16th, 2022. She's a good friend and colleague of mine, and I have the deepest respect for her and what she's doing. Dr. Monisha Bhanote. She's a quintuple board certified physician. She has a new book coming out, which I'm really excited about. It's called The Anatomy of Well-Being. I'm going to ask her about that. She's also an expert in the area of integrative medicine and anatomic and clinical pathology. And the topic that she's going to be speaking about at the summit is culinary medicine. She is so well versed because she's done additional trainings and certifications in mindfulness-based stress reduction, plant-based nutrition, Ayurveda, yoga for cancer recovery, yoga medicine, and she takes a whole body approach. It's something that we have in common. She's also a consultant and writes for Healthline. She's the medical expert, and she's also doing something called Holistic Well-Being Collective. So I want to ask her about that also. So Dr. Bhanote, it's so great to have you back on the program. I would love for you to begin by giving us an overview in kind of your philosophy, how you work with people, your teaching. I know you're you offer a lot of complementary medical advice to people. So I would like to introduce you to my audience. Tell us a little more about your philosophy.
Yeah, thank you so much, Sam, for having me back on your podcast. And I'm looking forward to the conference we're having in the new year. So the way I work with individuals is, definitely from a whole body perspective, but more so from a combination of lifestyle and really taking a look at how we can make our daily habits sustainable and optimize them. So really taking in how the body works, how we can optimize how the body is going to work. And doing that from, whether that's a sleep perspective, a culinary medicine perspective, a movement perspective, or maybe even emotionally, like really taking that whole body approach, because when there's a block somewhere, we're not going to get to the best level that we are able to get to. And also considering everybody is an individual, right? So you want to take your unique chemistry, your unique body into account.
Yeah, I love that. It isn't a cookbook approach, and you really, take an individualized perspective, but it's also very integrating. And how did this Healthline position come up? Tell us about it. How can people find you on this? Because you write a lot, and oh my goodness, you just offer such great info. I love it. I look at your Instagram every day. So tell me about Healthline.
Yeah, so thank you for asking. So I became part of Healthline Medical Network in the past year, and part of me joining with them is because they are the biggest source of medical information available on the internet. And what I like about them is that all their articles are being reviewed by medical experts in the field, and they take this feedback seriously. So working with them I have been able to help the writers who are writing the articles modify the information. So we're able to really share evidence-based information, but also start incorporating more of this complementary health, which is what I feel is part of the future. We can't just say that there's conventional and complementary. This is a entirely whole body approach, and we have to take every aspect of what's available, because for one individual, one thing might work, and for another one, something else will work. And that's really what I've seen. And the beauty is that Healthline, they're really focused on different generations too. So they have their own sub-publication, which is called The Greatest, which talks to the language of, a little bit younger generation, but we know health is across all ages. They have Medical News Today, which really gets into more of the nitty-gritty science. So for more the science-heavy people, and then Healthline is the more conventional, trying to understand health conditions. And of course, they have I believe it's Psych News Today or Psychology Today, which is the psychology aspect of it. So many great things happening there.
And they have such a vast network, and to have somebody like you on it, because I've read some of their bylines and articles for years, and I've been a little frustrated that they aren't, presenting the complementary medical, holistic, whole body, and that's where you come in. And you are able to put in science around it, which is really supportive. Yeah. And so for folks,
I'll tell you my latest 2 articles with them. One just came out, I think yesterday or day before, is on the Pitta dosha of Ayurveda. Another one that came out maybe a couple weeks back is about traditional Chinese medicine. So really looking at them from a perspective of the medical reviewer has to understand from their own experience what these things are, to make sure that the information that the writer is putting out is accurate.
This brings up something about Ayurveda. So I've had a number of patients diagnosed with wet macular degeneration, and they get the monthly injections, and there's a abnormal blood vessel growth in the retina. And one of the things that I've recommended with both of these people is to go work with an Ayurvedic physician and balance their doshas. And believe it or not, once they have, well, you would get this, their wet macular degeneration started to go away. And it was so exciting for me to see the power of Ayurvedic medicine in the use of Ayurvedic medicine and the doshas. So I'm a firm believer in Ayurveda, and I know you use that a lot. I also know you use yoga, and I want to move to culinary medicine for a minute, because you're going to be speaking about that at the summit. And just give us a sneak preview on a glimpse into, what you're going to be talking about and how you use culinary medicine in your practice.
Yeah, no, great question. So culinary medicine. So let's start with what are a few definitions around culinary medicine, because this is really, it's new terminology, so people might not be familiar with it. One definition that has been provided is that culinary medicine is the new evidence-based field in medicine that blends the art of food and cooking with the science of medicine, right? It's taking into account improving eating behaviors. It's focusing on skills such as food shopping, storage, meal prep. What it's not is, it's not dietetics. It's not like a single eating pattern, but it's really taking into, of course, evidence-based, but what's the biochemistry of nutrients? What are some healthy cooking techniques? What is high quality food? How can different cultures incorporate this? How can different socioeconomic classes that are predisposed to conditions incorporate this? So really looking at food as, what has been previously said, food is medicine, really taking that to heart.
Yeah, and there's so many factors that you bring into it, how to shop, how to cook, what are the foods you choose? So it's very integrative and holistic in a way that, it's not about a diet or, eat this food or, we see this on the internet. We've actually talked about it. And so I'm very interested, and I know my community is, on your perspective on how to help people through this particular specialty, because I think I've heard you say food is medicine, and that you're a guide in being able to help us do all these different facets of the culinary medicine perspective. So where did you learn this? How did this evolve in your development?
Yeah, so there is a number of training facilities across the U.S. that does this training program. I trained from a company called, let's see, it's CCMS, but it's based out of Tulane, where culinary medicine started. But now we're seeing culinary medicine kitchens in so many universities because when 95% of health happens outside of the doctor's office, a lot of stuff is happening at home, right? So we need to be able to share with individuals. Individuals are going to eat every day, regardless, right? We're going to eat, we need food, but really taking that into nourishment and understanding that what you put in your body impacts not only your body, it impacts your cells. It impacts how your cells communicate with each other. It impacts how everything's talking to each other. And I have seen tremendous changes when people change even small bits of what they're used to eating, because they didn't even realize that the starting point is, yes, your diet does affect so many things in your body, but the impact that just even small changes can make.
Sure. Yeah, it's so exciting. And I'm so glad to have you part of the summit. So for people just tuning in, this is Dr. Monisha Bhanote. She is a quintuple board certified physician. She's an author. She's got a new book coming out called The Anatomy of Well-Being. She's going to be giving a presentation at our summit on culinary medicine. So I want to shift gears now, and I want to move to something that you're doing called the Holistic Wellbeing Collective. So tell us about that.
Yeah, so the Holistic Wellbeing Collective is my private membership community for wellness business owners. It is a combined community for not just learning the business of wellness, but also keeping up to date with the latest science. And because to me, it's very important for the correct information to be out there, not fad diets and quick fixes, but really sustainable long-term health. And like I said, we have so many people that can contribute to that. It doesn't need to be restricted to healthcare systems and doctors. We've got health coaches, we have people creating health products out there. We have physical specialists like yoga and Pilates teachers. So many people who want to really contribute to the health and well-being of individuals. So I've created this community where we get together and we learn how to put our service and offerings out there in a way that not only aligns with our own goals, but aligns with really making a shift in the community and making a shift in the world with wellness.
Yeah. So when do you offer this? When is it going to open up again?
Yeah, so it's an ongoing membership, and I open it up 3 times a year. So the next opening will be at the end of January.
Okay, and how can people do that? How do they get in touch with you?
Yep, so they can go to the website, holisticwellbeingcollective.com, and sign up for the wait list there. They can also contact me via social media. I am at Dr. Bhanote on Instagram. And let me know that they're interested, and I'll make sure to get the information over to them. So they'll get notified as soon as it opens up, because my members are making great progress, not only with the concept of what is their offering, but getting their own clarity and getting clear on what they want to do and like what their purpose is in wellness. Like, they've gotten all these certifications and everyone's so highly trained, but it's very easy to get stuck in, let me get another certificate, let me get this, but then actually to cross that threshold to put that offer out. So that's where the community and the membership really comes to support.
Cool. So we'll definitely put that on our podcast notes. I want to ask you one more question, and that has to do with yoga. I know that you've done a lot of training in yoga. And how do you apply it to your practice, to your patients, your students?
Yeah, so I got into yoga really at first to help myself. Like, my practice brought me into yoga to help myself. And then when I started feeling the benefits of it on my own mind and my own body, and I'm like, there's something to this. There's really something to this. And, I was like, let me investigate a little bit more. And I looked at a number of programs to learn and be trained from. And I came across Yoga Medicine, which is where I have completed my 500-hour yoga teacher training certification from. And what I liked about their training is they really blend the science of how the body moves and the anatomical and alignment perspective, and even incorporating some traditional Chinese medicine into the body aspect with the yoga aspect. Wow. I got into it there, and now for me, it's become more of a personal practice. So how I incorporate it into my own life. But for my clients, understanding that everybody comes from a different place, and what's going to benefit them more at that time, because when people are dealing with health and disease, you can't just tell somebody, go meditate. It doesn't work that way. That creates more anxiety and more frustration. So you have to really understand what brings them joy, and how can you bring these small practices, whether it's a breathing practice or something, into their daily life to start making them more self-aware. Right.
Yeah, that's the key, self-awareness. And you seem to be able to turn that on for people, whether it's through the culinary medicine track, through yoga, through mindfulness, through Ayurveda. I mean, it's pretty amazing that you have brought all these things together. And so how can people get in touch with you? Your website, Instagram, say it one more time.
Yep. So my website for health and wellness information is drbhanote.com. My Instagram handle is at Dr. Bhanote. On Facebook, I am Dr. Bhanote. And then for wellness business owners, definitely reach out to me at holisticwellbeingcollective.com.
Well, we're really looking forward to having you at the summit. And thank you so much for your time today. I wish you the best, and I look forward to our collaborations in 2022. So
yes,
take good care.
Thank you, Sam, so much.
Thank you for listening. I hope you learned something from the EyeClarity podcast show today. If you enjoyed the episode, make sure to subscribe on iTunes or Spotify and leave a review. See you here next time.